Good day, my dear postgraduate students. Welcome to a new class on artifacts in histopathology. A thing of beauty is a joy forever. In fact, the word artifact means a beauty. However, it also means an error or a disparity from the constant appearance. This is an unknown area where the postgraduates can scope. We will be having any number of hidden viva OC questions in this. I shall be talking about the artifacts, what are the diagnostic pitfalls, and the histopathology that can be affected by it. And these are the various subheadings under which the topic will be dealt. Introduction, causes, classification, stages, remedies, and fixation. It is not the artifact alone. How are we going to rectify it? And when we say artifact, you all know that histopathology, particularly the processing and the staining part of it, contain multiple steps. And these include transport, processing, sectioning, treatment with chemicals, both in the theater as well as in the laboratory, staining, mounting, and miscellaneous other things. So anywhere you will be having an artifact or chance of an artifact which should be avoided or rectified. Look at this one. So this is a bundle of collagen, and what is not surprising to us is the cleavage between the bundles of collagen, which is not uncommon for us to see during the routine histopathology reporting. I used to wonder whether automation is a boon or a bane. Now that things have become automatic, we have forgotten the conventional, be it cooking or the processing of tissues or the driving of a car. You find that we have forgotten many a thing, the mechanism behind it and the reasoning behind it. Earlier, we used to have this kind of a histokinet wherein there will be a series of cylinders with multiple reagents. And there used to be an axis. And there used to be multiple radial levers. There used to be, again, a lift of this pivot or the axis, and it will turn over to the next reagent, and it will be sunk in it. But then, look at the development. This is something that you and I cannot even imagine of. Things are going on automatically. There is a churning and the changing of the tissue to the various reagents, which we cannot see, feel, touch. So obviously, we are forgetting the steps of the tissue processing. Note the delicacy in this particular picture. Though I'm seeing it from rear, I could very well appreciate the involvement of this particular individual, though an elderly person, in the sectioning of a tissue. Also, it could be very well appreciated, and I can imagine the joy that the person will be having when he or she gets ribbon sections out of it. Courtesy Wikimedia for this picture. As I've been telling you people, the artifacts can be because of chemicals, it can be because of the holding of the block, chatter, or the vibration of a knife, water bath, variation in the section, and staining as well as mounting. Anywhere you find that there can be faults, which we should be able to identify while we report the slides. So these are the conventional steps that are being followed, even though there is an automation. There is a collection, fixation, trimming of the tissue, then it is subject to dehydration, ascending rates of alcohol. Finally, there is a clearing, paraffin embedding, sectioning, staining, and mounting it with a cover slip. Now, what are the various steps for artifacts? 1. It starts from the theatre itself or from the surgeon himself. The clinical application of various chemicals. Many a time you would have seen foreign bodies in the section which do not elicit an inflammatory reaction because the tissue has been taken and then it is mixed with talc or whatever it is. So these can be because of surgical mishandling of the specimen. Local injection of anesthetics. This also can lead to artifacts. Inadequate tissue fixation. This is extremely important, both in the theatre as well as in the laboratory. And the medium of fixation. Even though every institute has got an established fixative, you find that the concentration of it varies. And the person who dilutes it does not know the exact. Surgical suctioning is, it is not sectioning, it is suctioning. Sometimes when the tissue is being removed, it is subject to negative pressure, therefore artifacts are probable. Look at the separation of the collagen, that itself can be due to this. Excessive heat, it can be what is called as heat diathermy. When they do a cauterization, heat cauterization, in order to avoid bleeding, you find that the tissue that is in the periphery will be obtaining a basophilic tinge without any cellular detail whatsoever. And freezing also. Similarly, there can be a swelling or there can be an artifact that is created. Embedding sponges. So these again can be an improper staining, obviously. So these are various steps where artifacts can occur and these should be borne in mind. Let us start with the surgery itself. Injection artifacts. The injection of an anesthetic agent, or it can be because of a hemorrhage that it can cause. And the remedy will be to avoid any direct contact with the tissue that is intended to be studied. Forceps. Again, there can be a crush artifact. Many a time the tissue itself has got a small cell carcinoma, for example. You find that there will be a crush artifact. But it is better that instruments such as tooth forceps are not used. And the remedy will be using a blunt scalpel or atraumatic ADSense forceps. Fulguration, electrocautery, which can lead to coagulation of protein. The remedy is it is totally contraindicated in cases of biopsy. In larger tissue, of course, we can't prevent the bleeding, therefore it has to be done. But in small biopsy, that biopsy is the key. Therefore, it has to be done at a margin away from the lesion. Use the scalpel first. You cut it and then the electrocautery, not vice versa. Collagen separation can occur due to anesthetic injection. Look at this over here. The bundles are being separated. Nothing wrong in the tissue per se. This is just a recall. So whenever we get a tissue and then we give the bits whatsoever, you find that there will be the various reagents it passes through. The alcohol, various grades of it, and then there is an absolute alcohol, the clearing agent such as xylene, then the molten paraffin. This is called as impregnation. Finally, there can be an embedding in wax. So this occurs. We should be able to recall what each of these can be causing. Now, many things in, but memories last forever. So what we should do is memorize. Memorize the various steps and the artifacts that can be occurring along with them. Fixation artifact. This can be because of the change in the tissue volume. A large voluminous tissue in a small amount of fixative. Permeability. Ions. Collagen, it can swell. Formaldehyde and wax, on the contrary, can lead to shrinkage of the tissue. Nuclei in the frozen sections are much larger. Prolonged fixation again can lead to fixative shrinkage, and hypertonic solution can also lead to shrinkage. Hypotonic can lead to swelling, osmosis. So these are things that we should be having in mind. It is not sufficient that we are a good pathologist. We should be a good histotechnician to some extent. The artifacts due to fixation can be because of delay. Many a time you find that the surgery has been done, but the tissue is not immediately transferred to the fixator. Displacement of the material, example, glycogen, etc., by means of this can lead to a streaming artifact. Diffusion of material affects the enzyme histochemistry. Usually you find that enzyme histochemistry is a very delicate one. It is not immunohistochemistry, it is enzyme histochemistry. That can be affected by the various agents. False fixation of extraneous material, example, radioactive material, etc., can be included in it. Improper or delayed fixing can lead to autolysis, which is very, very common. Tissues like the endometrium, etc., can undergo an autolysis. Please do not forget, remember all these things. Now, this is the same tissue. You find that there is a difference between the two. What are the differences? It can affect the shrinkage of the tissue. For example, this is more shrunken, this appears more bloated. Clumping of the chromatin. This is, again, it is more vesicular, whereas it is appearing hyperchromatic over here. Nucleoli need not be seen. Vasculature, not clearly demarcated. Collagen can appear very amorphous. It is over here, the collagen. And the alcohol can lead to severe shrinkage as well as make the tissue a little brittle. Sectioning artifacts will lead to this kind of initial blinds I shall be showing. And there can be the loss of cellular details, particularly in cells such as the RBCs. Look at these regions. Probably there are some RBCs which I am not able to make. So both are the same tissue, and in different methods of fixation, you can see the changes in the tissue. Now, there are some artifacts. As I told you, artifacts are certain changes which occur during processing. You get thin and thick sections, alternate. This can be because of a loose blade, loose block itself in the block holder, insufficient clearing. Clearing means it is an angle between the block and the knife. So in such cases, you'll have to tighten, increase the clearing angle. Chatter effects. Again, a vibrating effect because of a loose knife or a block. Or sometimes the clearance angle is too steep. These will have to be rectified. And sometimes in tissues with calcium, they have to be decalcified. Otherwise, I have seen blocks which go and touch the ceiling once I start the section cutting because it is too hard and it goes up. Knife lines can be because of the damaged edges of the knife. Though we are having disposable blades, you should know that there can be artifacts because of it. In such a case, ask for a new knife or a new blade. Venetian blinds. Alternate hard and brittle areas in the blocks. This has to be softened before cutting. Excessive compression. This can be because of a blunt blade. Instead of cutting, you find it compresses the block. Softer wax can also be a problem. This has to be replaced with a new blade and cooling has to be done. Incomplete sections. Incomplete impregnation. In such a case, we'll have to reprocess or re-imprint. So these are again important. A very good table that has been picked up. Kindly memorize. The common artifacts that you people are seeing when you are facing the examiner, they can ask you what are the common artifacts that occur. It can be because of folds in the section, folds or pleats, a folded cloth, for example, or common in a hard tissue. Cloudy appearance because of faulty dehydration. It appears quite hazy. I keep on wiping my microscope, but the image does not improve. The remedy is to rehydrate and to repeat. Dirt or dust particles, but I'll be able to make out because these are in different plates. Use a fine adjustment, one will be disappearing, whereas the other gets focused. Foreign bodies, such as the glove powder in 5 minutes. But all of this will not be eliciting a tissue reaction. Therefore, I can be sure that they are foreign bodies. Pollen grains in a DPX mountain. Quite very strange examples I have seen. So look at this tissue. It is all well stained over here, but towards the surface, I find that it is not being properly stained. Obviously, this area is not properly waxed. Another one is sometimes we are eager to mark the edges. But in such a case, we should remember that there can be a dye artifact also. So please remember this. Thanks to Roy C. Ellis for this picture. Artifactual cleavage. All of us, it is a nightmare for us. The pemphigus lesions or the vesicles and the bullous lesions. There can be an artifactual plane of cleavage. The epidermis is being separated from the rest. And look at this one. There is a definite line of cleavage. It appears almost like a bullous lesion. This is the Venetian blind I'm talking about. Whenever we talk of a blind, it is this. So it is to allow partial light or improve the light, etc. That is the Venetian blind. You people know about it. But then look at it. In the tissue, I'm finding that there are marks like this Venetian blind. This can be because of a cutting artifact. You get parallel lines that are there. Hardening of the tissue in the paraffin block. Or sometimes it can be a defective assembly of the microtome blade. Three things to remember. Quite simple. In all this, you'll be finding this. So in this case, I'm finding there is a thick area and then a thin area, alternate, as though it has been folded. This can be because of a defect in the locking mechanism in the microtome. A dull blade, it is being used. The angle is too high. The sectioning is being done too quickly. We should allow it to cool or apply ice over the block. And poor tissue processing itself. So there is another topic on its own, but that we should be having in mind. Look at the alternate thin and thick areas. Artifacts and fixation. Many a time we are jubilated because we are seeing fungal organisms. But then you will have to apply your mind. Now in this particular case, I am not only seeing the hyphae, I am finding the sporangium, the endospores, the conidia, etc. Everything is being seen. This is possible only in a culture media. So probably there has been some amount of contamination where the fungus has been able to thrive. And such a case, judgment is needed. Please correlate with microbiology and ask for a repeat sample before you release the report. So this is a Venetian blind artifact that I am seeing. Microtome. Scoring. Scoring is a cutting through. Many a time, no, as and when you ask for the deeper sections, any number of sections you take, all the sections will be appearing like this because there can be a mark in the knife. There can be a small foreign body or there can be a niche in the blade. This will be causing it. And sometimes a blunt microtome knife can lead to a folding of the tissue like this. So these can be corrected with the knife. This we have already seen. Sometimes artifacts can be leading to acantholytic effects. Supposing the formalin is in excess, you find that the preservation of the basal layer and the underlying tissue will become a problem. So it can mimic a Darius disease or pemphigus. And curling during fixation can be prevented by using a glazed paper, he says. What are the artifacts during the transport? This should have come even earlier. Freezing artifact. Sometimes you find interstitial and cytoplasmic vacuums. The remedy, he says, is you use this alcohol-containing fixatives. Acetic acid will be causing a swelling. This is too chemical, but then you people can remember one or two here and there. Artifacts, as I told you, curling. Use a rigid cardboard or you can use what is called as elliptical biopsies so that all the layers are being represented. Floaters. It is again a nightmare. Sometimes it is an irritant, but sometimes I'll be able to see a malignancy in an otherwise normal tissue. So this can come either during the grossing from some other tissue or from the water bath. I should be able to suspect it. The floater is suspected when the fragment looks different, a foreign body like it. So it is somewhat finding a European in India. Different planes of the tissue, as I told you. As you move it, you will be able to identify. And the pathology is totally different. Once I had a very bad experience of finding an endodermal sinus tumor in an appendicectomy. Where it came from, we do not know even till date. The remedy is clean boards, clean cassettes, clean instruments. Sponge artifacts. The cassettes that are sandwiched between the sponges can be having it because the sponges have got angulated holes. Therefore, the permeation will not be uniform through. The remedy will be using a tissue paper which permits the reagents to pass through uniformly. Artifacts in alcohol, we have already seen, shrinkage can be there. Vacuoles can be lost. That is, fat can be lost again due to alcohol because it is dissolved. Alternate thin and thick areas or sections. This can be leading and trailing edges. Knife is blunt in one area. You have to sharpen it. Surplus wax on one side. Trim the wax. And the tissue varying in consistency, reorient, apply ice. You'll have to trim with a scalpel for the parallel edges. These are all things which we used to do laboriously. But now even this area is being made, being mechanized, that we are losing track of the entire process. Pigments can be artifacts. Formalin, for example. You find that there can be a brownish pigment that is there. Malarial pigment, again a black pigment, or bilharzia. It is intracellular. The remedy will be, you will have to use a non-formaldehyde fixative, such as a neutral buffer. Avoid prolonged fixation. And this can be removed by means of alcoholic ammonia. Look at this formalin pigment over here. We used to have doubts whether it is some kind of hemocyanin pigment or is it melanin, etc. But then when I move it under the fine adjustment, I find that one appears, the other disappears. Also, you find with the lysis of RBCs, this can be a problem. The remedy will be using alcoholic ammonia. Mercury can lead to dark brown irregular masses. The remedy will be the oxidation. Chromate fixatives again will be giving yellow, brown or black pig. Remedy is treatment with acid alcohol. Stain deposits, amorphous. They will have to be removed by filtration. This is a usual problem when you do a GMSA stain for the H. pylori. You find that it is covered with precipitate. It can be filtered and restained. Paraffin bags, it is refractile. Many a time we find that there is some pathology I am not able to see it. Probably I am developing a cataract. But then what is the problem is you will have to dewax. Water droplets again, they appear very small. The author has made a very beautiful observation. It is brown in color. Water actually is colorless. It will be brown in color. You leave it. After a few days, the entire section loses the stain. These stains we know. Hematoidin, hemosiderin, and melanin. So if it is going to be a melanin pigment already, you bleach it. If it is hemosiderin, you do a pulse pressure flow to confirm it. So a thing of beauty is a joy forever. Artifacts. There are beautiful artifacts which we spend a lot, and these are again being uncovered. I would like you people to kindly go through the entire list. And he is one of my very favorite authors, Ralph Waldo Emerson. Every artist was first an amateur. Probably you people are, but tomorrow you are going to run the largest of labs, and you are going to sit in a seat where you are going to control dozens or even scores of technicians. Unless we know the techniques and the artifacts, we are likely to be landed in troubled waters. I wish you all the best.